If tired and heavy legs and unsightly varicose veins have stopped you in your tracks, my next guest can help you get up and moving again. Joining us with a non-invasive way to diagnose and treat the problem is Dr. Rajiv Agarwal with Modern Heart and Vascular Institute. Good morning.
Morning, Deborah. You're looking very nice.
Oh, thank you very much. All right. When it comes to, I talked about, varicose veins, tired, heavy, achy legs. A lot of people dismiss it as, okay, that's just a part of aging or it's no big deal. But it really does impact your life. And if you see those outward symptoms, then something else bigger is oftentimes lying beneath.
Yeah, that's absolutely right, Deborah. People do dismiss it as just everyday common issues, but this is actually a medical problem. People think that they have restless legs or numbness in their legs, and they think it's something else. No, it's a very common circulation problem. Affects millions and millions of people. There are about 60,000 miles of blood vessels in our body, and people need to pay attention to those symptoms.
Yeah, because when you have that circulation, Dr. Agarwal, what is that serving as a purpose for in our body?
Yeah, so there are two types of blood vessels, Deborah. Number one, you have arteries, which take the blood from the heart to the toes, and then veins bring the blood back. So the function of the arteries is to take oxygenated, rich blood to the tissues. The tissues use them, and then the veins bring the blood back. Now, most of the symptoms in the legs are usually due to vein problems, though.
Yeah. All right. So arteries, poor circulation symptoms could include what?
Those symptoms are usually with walking, Deborah. So if people get any tiredness in their legs, any numbness in their legs, and they have symptoms with walking or going up a flight of stairs, it's usually arteries. Whereas vein symptoms tend to happen more at rest. So if people have Charlie horses, restless legs, swelling, varicose veins that they see, just fatigue and tiredness that affects their sleep. There are millions of us Americans who are losing sleep at night, and we think, it's okay. No, it's not okay. There are little things that can be done because these veins that you see on the screen have valves inside them, and if the valves are not working properly, you get a lot of symptoms, and those are so easy to fix nowadays, Deborah.
Yeah. All right. The risk factors for arterial disease include what?
So arterial disease is similar to any other blockages that you get, whether it's in the heart arteries or your carotid arteries or legs. So that would be diabetes, high blood pressure, high cholesterol, smoking, family history. And let's throw in COVID nowadays also. People that have had COVID, that inflammation that has happened in their body can accelerate the blockage process.
Yeah, all right. And then with venous disease, obesity could be a risk factor, stationary lifestyle, desk jobs, things like that, hormonal issues, blood clots, varicose veins, and diabetes. Here's the deal with either one of these issues. If you ignore it, generally speaking, things just get worse. How bad could it get?
Oh, it can get really bad. I mean, we see people whose quality of life and quantity of life is very adversely affected. We see people, just last week, I had a couple of patients that I saw that came to us so late, and they were recommended to have amputations by their doctors. Wow. But we were able to do what we do and prevent those amputations. So the earlier we catch this, the more options we have, Deborah.
All right. For diagnosis, that's pretty simple for you all, right?
Very simple. Step one is we talk with them, we listen to them, we examine their legs and see what the issue is. And then if needed, you get an ultrasound that will clinch the diagnosis. Basically, is it arterial? Is it venous? How bad is it? And what do we need to do to fix it?
Yeah,
very easy, painless.
Yeah. And if there's a blockage, you have almost kind of like what we jokingly call it the roto-rooter procedure.
Yeah, for arterial blockages, it's an outpatient procedure. You come in, we fix it, and you go home the same day. For vein disease, it's a little bit different. It's done in the office, and it could involve a 5 or 10 minute procedure. And all these years of having significant vein issues, varicose veins and Charlie horses, restless legs and pains and discomfort, pretty much gone. It's like magic, but it's not magic. It's a medical issue. We treat it, and your life is back to normal.
Yeah, and you done in the office, and you get up and go along with your day. Also, we touched on restless leg syndrome, which I hear these commercials for. There's medicine for it. You want to get rid of the problem, not treat the symptom.
Yeah, you got to aim for the cure. You find the root cause of the problem, and 90% of the times, or sometimes even more, it could be circulation issues. You fix the circulation, and it goes away forever. We spend so much time taking care of our car, our tires on the car, but we ignore our own bodies. The legs are like tires. If your legs don't feel right, we can help you. We can
Yeah.
get them back to normal.
The body's the ultimate machine. Thank you very much.
Thank you, Deborah.
All right. To book an appointment with a board-certified cardiologist at Modern Heart and Vascular Institute, visit them online at modernheartandvascular.com or give them a call. Here's the number. It's 832-644-8930. Again, that's 832-644-8930. They accept most major insurances, including Medicare. Appointments fill up fast, so contact them today. And by the way, they have doctors who are fluent in Spanish as well. Modern Heart is also seeing patients in 2 new locations in Tomball and the Texas Medical Center with free parking.